Hi, I'm Dr. Carpentier. I'd like to talk to you a little bit about spinal cord stimulation for the treatment of refractory pain. Spinal cord stimulation is a technology that's been around for decades, but recent innovations in the last 5 or so years have made this a much more effective technology for the treatment of recalcitrant pain. Indications for spinal cord stimulation include failed back surgery syndrome, failed neck surgery syndrome, CRPS or RSD of an extremity, diabetic peripheral neuropathy, and a number of other peripheral neuropathies which are non-surgical and which are not improved with medications. The technique of spinal cord stimulation is relatively simple. It requires the placement of spinal cord stimulator leads into the epidural space overlying the target areas of the spinal cord. With the patient awake, we then change the frequency and amplitude and positioning of the leads until we obtain paresthesia coverage in all painful areas. The stimulation coverage is felt to be effective by activating descending neuromodulatory neurons. So rather than acting as a gate control for pain and simply blocking sensory input, what it seems to do is modulate the input via the descending inhibitory neuromodulation system. This is not part of the opiate neuromodulatory system, and this technique cannot be blocked with naloxone. It does not provide anesthesia, it simply provides analgesia, but the analgesia can be quite profound. In order to progress from trial to permanent implantation, part of the criteria is that patients gain 50% or better pain relief, that they are able to increase their functional activity, and that they require fewer medications. All of this can be determined in about a week to 10 days of trial period. And once determined, if they meet the criteria for implantation, it involves simple soft tissue surgeries that are completely reversible if necessary. Implantation rates vary. For axial low back pain, I have implantation rates on the order of 35%, meaning 35% of the patients we trial get meaningful pain relief, better than 50% reduction in pain, significant improvement in function, and a decreased reliance on medications. For conditions such as CRPS, implantation rates climb to almost 80%, again indicating that they're gaining significant improvement in pain control and need for medications, as well as significant improvement in function. Newer battery technology is now rechargeable. It no longer requires surgical revision in order to replace a battery. And bench testing on some of these batteries indicate that they're going to last in the order of 10 to 20 years. So it may only require one surgery for long-lasting or even lifetime pain control. As is true with any surgery, patient selection is really important. Most of the treatment failures involving spinal cord stimulation can really be traced back to poor patient selection rather than a failure of the technology itself. The technology does what it's supposed to. It delivers electricity to the target tissues reliably and predictably. As a general rule, it's more effective for treating neuropathic pain in the periphery than it is in treating axial pain. Patients who suffer from failed back surgery syndrome who complain primarily of radiculopathy, or patients with severe extremity neuropathies, tend to do better than patients with diffuse or poorly localized pain. The advantages of spinal cord stimulation are that since it's performed in a trial phase and the trial involves only percutaneous placement of an electrode, power supplies are externalized, it doesn't require much surgery in order to determine if it's going to be effective. As far as I know, this is really the only surgery available today that you get to test drive before you commit to it. While the hardware can be expensive, cost analysis has shown that break-even point occurs in about 18 months. And the cost of the device itself becomes less expensive than all the other healthcare that would have been delivered in about 18 to 24 months, making this a viable long-term treatment option. If you have any other specific questions about technique or indications, I'm happy to discuss these with you individually. Again, I'm Dr. Carpentier. I hope this information on spinal cord stimulation has been helpful.